I can see you all coming on board, so we'll just give it a couple of minutes for everyone to sign in. Perfect. I can see we're nearly there. We're nearly there. Right, team, we'll kick off. Morena. I'm Kylie Ryan. I'm the project lead for the All Population Suicide Prevention Community Fund that Mental Health Foundation um, are, are managing on behalf of Te Whatu Ora. So today I'm going to go through the criteria, the eligibility, and try and answer as many of your questions as I can. We have a Q&A box there. Now, if you have any questions either throughout the webinar, if you can just type them into that Q&A box for us, and my little admin team behind the scenes will try and answer what they can as we go. However, if there's some left at the end, then I'll spend some time at the end answering those as well. So feel free to brain dump and pop any questions in there as we go along. Otherwise, we'll crack into it. Just FYI, we are recording this and we will also make this available to everyone after the webinar so that you can use it while you're making your applications and share it with your networks if that is suitable. Alrighty. So, look, the fund is part of the Suicide Prevention Action Plan, the 2025 to 2009 Action Plan, and that action plan comes out of Every Life Matters. Okay, so prior to this fund becoming available, from the previous action plan, we had both the Māori Suicide Prevention Fund and the Pacifica Suicide Prevention Fund, and Te Rau Ora managed the Māori Fund, and LeVar manage the Pacifica Fund. Okay, so they are still going strong, and they are some of them. I think they're just about to announce some of the grantees, and one of them is also just opening. So, just a heads up if you didn't know that those existed, to also have a look at those. This fund is for all the population and it also includes Māori and Pacifica. So you can apply to both funds, which we'll go through as we look at the eligibility criteria a little bit more. Cool. So, look, the difference between this community fund and other ones that the Mental Health Foundation hold is that this is particularly in the space of suicide prevention and postvention. Okay, so what we want to see in your applications is that your project is aligned with best practice when it comes to both suicide prevention and postvention. And this is really important, and we are looking for this in our shortlisting process. Okay, so definitely read through that Every Life Matters document, read through the action plan, and also pop onto our website and look at our suicide prevention resources. But to give you a kind of an idea around the prevention based projects and postvention that we will be kind of best that fall within best practice. These are the things that we know from a suicide prevention perspective, strengthen communities to be able to do that primary prevention. Okay, so we know that strengthening protective factors around high risk communities, reducing those risk factors, and that's just a small list. There will be many more protective factors and risk factors for your community. We're trying to build that capability within those communities who experience higher risk to be able to recognize early when someone needs help and then respond in appropriate ways. Okay, help seeking is really difficult for people when they are at high risk of suicide. It's not as easy as, calling 1737. So we're really wanting to make help seeking and access to support easier as well. Okay. We're looking across the prevention spectrum at interventions and projects. So we've got that really primary prevention focus where we're building up communities with skills, making sure we're wrapping around services and getting those protective factors in place. But also, if you read Every Life Matters in the Suicide Action Plan, there is also a strong need to build appropriate support services for communities and really strengthen those ones that exist and build those community networks. As a side note here, do be careful around the kind of language that you're using when we talk about suicide prevention. So I've seen come in to the conversation a lot, is that kind of awareness raising projects when it comes to suicide prevention. And we wouldn't see awareness raising of suicide as best practice. Now, the reason for that is, for example, if you were to go in and share conversations around suicide and that wasn't backed up with a strengths-based approach, that's sharing hope and how people came through, and really importantly, showing how you're going to connect those communities to ongoing support. Okay, so it wouldn't just be a one-off conversation that you're having, there would be a project around that where you're expanding and making sure you're building that capability. When we look in regards to postvention, we are really trying to reduce the risk of that suicide contagion that we know can happen post-suicide in a community, but also how do we support all of those people impacted and provide safe places for them to have conversation, support, and grieve, and then build that capability within the community going forward. Okay, so that's kind of a 101 for you on the type of projects that we're looking for as we go through the applications. Right, when we look at priority populations, the reason there are priority populations within an all of population fund is that we know suicide risk is really inequitable across our population. Okay, so we want to focus on those who are most at risk because that's where we need to see that change, support, and growth within those communities. Now, for the first five there, maternal, men, youth, rainbow, rural, those are some examples about what we know from a prevention aspect. Kind of works within those communities given what the social determinants are for them. Okay, so it's just to give you an idea, but they are by no means an extensive list of what we're looking for. So we want the creativity, we want all of that to come through. We're also very aware of that lived experience voices is very important within this field, and also knowing that there'll be kind of sub-communities within these who need different things. Okay, so it really is open within there. Māori and Pacifica, like we said, is also open within this fund, and we are really wanting to look at Te Ao Māori and Pacifica frameworks and ways of working within those communities around that suicide prevention postvention. Okay. Every community, so while I can't put every community's kind of name down there, if you don't see the name of your community in this list specifically, that is not an issue. Okay, so we know that we have sub-communities that are definitely at higher risk of distress. Now, they may or may not be reflected in the National Suicide Risk Data just because of the way that's collected. If there isn't representation in that risk data, that is fine. What we want to hear is the voice of that community and what they're experiencing coming through in your application. Okay. So hopefully that kind of sums some of that up for you. And I can see questions coming through, and I am going to go through, I'll answer what I can. So yes, rainbow is queer across that spectrum. No, not necessarily, Chris. There isn't a weighting towards either prevention or postvention. The weighting will be on impact. Okay, so we may not see an equal amount of prevention and postvention. It's going to depend on those applications that come through. But we definitely want to see a spread, of the population groups across the applications that are funded, and also obviously a mix of that prevention postvention. Okay. But for example, if we get, more prevention and less postvention, and they don't reach the kind of criteria that we are hoping, then that will be the cutoff. So we may end up with an unequal amount dependent on the applications that come through. So who can apply? Literally anyone. So this funding, the reason it is so open is because it recognises that community-led input is where we're going to see development in this area. People are the own experts within their group who are experiencing higher risk. Okay, so this includes organisations, and everyone you see on this list. You do not have to be a registered charity. You could be an individual with a great idea. Okay. What we are wanting to see, and which I'll talk to more on the next few slides, is we want to see that communities are connecting, both within, if you've got a certain priority group, that there is a lived experience coming through from that population. Okay, so we're not putting a project onto a group, they are part of the solution that we are looking at. And also because we really want to increase the ability for people to access supports and networks, that community partnership will be weighted. So where we see that strong community partnership and growing communities, then that will get a tick. So just think of that as you're considering making your application. Right. The other criteria that is in there is that this has to align with the objectives of the Every Life Matters. Okay, so if you haven't read it yet, it's definitely time to pull out that document to make sure you align it. This is a summary of those objectives for you, and the kind of things that kind of pop out would meet that kind of best practice requirement about it. Again, it's not an exhaustive list. So if you don't see your project reflected in here, that's not a problem. Okay, you just need to be able to show those links. So when we're looking at the postvention side, we're really looking at providing support to those communities. Okay, now how do we increase protective factors? How are we providing spaces? How are we providing those with lived experiences to talk safely in safe spaces and share that loss, but importantly, also that hope going forward? Okay, the next three are grounded more on the prevention side. So when we look at resilience, we're not necessarily looking at that from an individual resilience perspective. Okay. The wording in Every Life Matters is that community resilience. Okay. So it takes a village. So we're really wanting to see that co-design, the community groups working together on projects to work to improve those protective and risk factors for people in the early stages. The encouraging focus on mental well-being goes across those priority populations, and this may look very different for populations dependent on the framework that is used. It could be a cultural framework, it could be grounded in other best practice as well. Okay, but this is where we've got the project programs, those new ideas coming through, coping skills, kind of all those social determinants that we know can lead to mental distress. Okay, now those determinants are different for population groups. So really know your population and what works for those groups. The support services, this is a huge amount of feedback at Mental Health Foundation that we get back through our lived experience voice, is that it is just so hard to access support, and where do we get that from? Okay, so we're hoping to build those communities, not just within a single, it might be nationwide, might be a project looking at how we make that easier and more effective for people to access. Okay, so hopefully a few ideas in there for you, but those are the four main objectives. You don't have to meet all of them, but do know your priority population and understand the suicide prevention best practice behind that population. Right, so what they must do, they must be community-led in design and development. Okay, we want to see that community voice coming through. The time and budget, so I will go over the whole application timeline, but the projects will run from June this year through to June 2007. So you have 12 months to complete your project, and we've got time before that to do the project plans and that side of things. Okay, but 12 months for the actual running of the project. From a cultural, oh, missed there the budget. So we have $1.5 million in total, and the applications must fall between that $40,000 and $100,000 mark. It can be anywhere in that range. Okay. Now we haven't got any weighting and said, we're going to fund to 100K and 40K. It's totally going to depend on the applications that come through, and it will be up to the judging panel to decide where we are going to see the greatest impact for our priority populations, to where that budget falls and where it goes to. Okay, so don't make a lower application thinking you'll be more likely. The reason we have made it 40K, which is quite a significant amount compared to some of the other funds, is because we are expecting projects with a good level of impact. Okay, and obviously you need the resources and the specialty knowledge to do those. So that's why it's a higher budget. Okay, we do look at the budget as part of our shortlisting. So make sure it is realistic. Do your homework about how much things cost. I'll talk a little bit more because there's always lots of questions around operating costs and salary and how we fit those into the budget. So I'll talk to that specifically in the next slide. Whatever community you're working in, we want to see, particularly if you're working with certain priority populations, we want to see that those frameworks that you are using and that the project shows that you understand the cultural competency required for working in that population. Okay. Now, when we do the shortlisting, we have a specialist team within the Mental Health Foundation who will be looking particularly at this in regards to certain populations. Okay. We have our Māori development specialist who will sit over top of the entire judging panel throughout the entire process, and will be advising particularly around NETL Māori applications and frameworks that come through to make sure that they meet the needs of Māori communities. Also, even if you are working, for example, with men, and within that group you have diverse populations, we want to see that you understand your te tiriti obligations within there and your obligations as a tiriti partner within there. Okay, so take that into account as you are going through the process. So this is the most questions we've had through so far. So hopefully this answers a lot for some of you. So look, general operating costs are those things that are already existing in your agency that you're going to need to draw on to do your project. Okay, so for example, you might need some administration costs because of all the emails back and forth, and that might be someone who's existing within your organization. Okay, so those overheads are capped at 20% of the budget. Now, what we won't be funding, and we've had a lot of inquiries about this, is salaries within organizations. So for example, I've had questions around, would you fund, what we work with, for example, young people in youth justice, and what would really make a difference for those young people is if we had a funded suicide prevention coordinator as part of our team. Okay. We are not going to fund a salary for a position. However, what I want you to look at is if you had a suicide prevention coordinator for your population of young people, what is it they would be doing? Okay, and what is a project that you would be building on those Every Life Matters objectives? What is a project that that person would be doing? Okay, so we are wanting to look at how we measure the impact of a project. And as part of that, for example, you might have a project lead. Okay, you might have facilitators that you need to run courses. You might have training that you need to deliver to upskill the people who are delivering that. So those kind of costs that are project-related costs are additional to your operating costs. Okay, and more than happy to talk through that further, but no to like just a salaried position. We are looking for a project, but you can include the project costs in there, which may include personnel. Okay. Any salary base that we're covering that is existing within your organisation has to be capped at 20% of that budget. So hopefully that clarifies it for everyone. We won't cover any of those personal and capital items that aren't part of the project. So um, we wouldn't, for example, put funding towards a vehicle for the project. However, you could include vehicle costs in there. Okay. Activities that are funded elsewhere. So if you have already received funding for a particular project, then particularly if you've already applied to the Māori and Pacifica Suicide Prevention Community Funds, then those won't receive funding under here. However, if it is that project and you have now got growth happening in that project and you've evaluated and you've had new outcomes and there is a new initiative within that project that you would like to apply for, then that will be considered. Okay, so it can be kind of growth because what we're trying to do is get that sustainability coming through and learning as we pilot these programs and move through them. Service delivery is not funded. So again, I've had a lot of questions on would we, for example, fund therapy sessions or certain types of therapy that have been shown to be more effective for suicide prevention? No, we wouldn't. Okay. Again, though, if you have a project-based application and part of that project is some type of group therapy or you're improving the accessibility between organizations, then the project would be considered and the project cost would be considered. But we're not going to be funding therapeutic sessions for individuals as such. The reason existing courses and existing mental health first aid courses aren't covered is because Life Keepers is funded by Te Whatu Ora and delivered through a number of providers, and that is seen as best practice in suicide prevention. And there is funding that goes towards organisations delivering the Life Keepers course. Okay. But if you've got new ideas and it's based in best practice research around what works in suicide prevention in certain population groups, then put it to us as an application. Okay, the project has to happen within Aotearoa, New Zealand. One-off events are not a thing in suicide prevention for the same reasons we talked about before. Okay, we don't want to be going into communities and raising awareness and then walking away and not providing the services to follow up. Okay, the only time we would consider one-off events is if we can see that clear impact on that community and that you can link that to suicide prevention outcomes and impact. So for example, you might have a massive one-off event for youth and you're bringing all of those youth, let's say rainbow youth that perhaps wouldn't otherwise have the opportunity to come together and network. We'd want to see within that event that that is the goal of it. And then we want to see that after that event, how is that going to continue for that group and how has it improved the support and outcomes for them long term? Okay. Hopefully that clarifies that funding side of things. I am going to go through and answer these questions for you at the end as well. Okay, so what makes a strong application? I'm just going to take a sip of water. Okay, these are, when we have a scoring matrix, these are the things that we're really looking for within your application. Okay, so if you're going to take note of any slide, here it is. Really think about that sustainability and focus on impact for your population. Okay, but I want you to, clearly explain these as you go through. When you go into the application, we've tried to make it as easy as possible. So the questions are pretty upfront and we've asked those questions because, we are weighting in accordance to those questions. So, make sure you're putting kind of due process and research into answering those. Community engagement is important. Okay. make sure that you are networking within your community, make sure that you have that lived experience voice coming through for your priority population. We are wanting to evaluate impact. So have a little think, you'll have your quantitative data about perhaps how many people have attended, those sorts of things, but have a little think about how you would measure those perhaps increase in protective factors or decrease in risk factors, those sorts of things. I've already mentioned all of these things, but I want it, to be right there highlighted for you. Definitely worth your while making sure you've got your head around these documents before you make your application. Final slide, and then I'll get into your questions, people. So this is the process for the applications. So they close on the 17th of March. So you've got about a month and a bit from now. Then they come to the specialist suicide prevention team within the Mental Health Foundation, and we will be shortlisting the applications that come through. And they will then go through to a judging panel who are experts both within suicide prevention, but also within those priority population groups. Okay. And they will be the people who then make the final decisions around who goes forward for funding. Okay. So the decision will be announced on the 4th of May. Is when the applicants will be decided. We will then obviously be in touch and we're going to start the contracting process, getting your project plans in place. On the 20th of May, we'll have an in-person hui at MHF that is fully funded as part of the fund. So we will be bringing you all to Auckland, taking you through all the evaluation, the kind of process stuff, but also time for you to meet each other and hear about all the fabulous work that will be done in the next 12 months. At that hui, we've also put into the fund mentors for successful applicants. So those mentors are yet to be decided because it will again depend on the applications that are approved. But those mentors will be specialists in suicide prevention and postvention, and also within the population groups that you're focusing on. And they'll sit beside you to help around, safety of conversations, safety of what's happening in those projects, but also brainstorm as challenges come up throughout your project. Okay. And then sorry, I know I said June earlier, May. So May this year to May 2027, the fund, I then have a month to report back to Te Whatu Ora on all the wonderful work that's happened over those last 12 months. And then hopefully, fingers crossed, we get another round to look at this again in the next year. Okay. Perfect. So let me have a look at all of these questions that are here. We don't know yet, Tiffany, whether the all the population will be funded past the end of 2027. We would hope so, but you never know. You never know. So we have our fingers crossed, but unsure. The other community suicide prevention funds are in their second round now. Okay. Kirsten, yes, you can absolutely apply for two projects. What would make it easier for us is make sure they are different projects with different names so that we can see it's not a duplicate application. But yes, one organisation can absolutely apply for more than one project, particularly when you've, like in this example, you've got different priority groups within there. Okay, and yes, you'd include costs. So they'd be separate applications, and you'd include costs for each of those projects. Okay, so two applications for different projects. So the other 80%, like we said, is project cost. So that would include, for example, a project coordinator or a project lead. It might be facilitators, it might be travel costs, it might be costs of resources that are required to give out to people throughout the project. It might be specialist speakers coming in, Kai, anything related to the project delivery comes into that 80%. I'm more than happy before your application. If you haven't made an application kind of this big before, please feel free to give us a call and we can look over it for you. And also just talk to other community organisations that have probably done these kind of applications many times before, and they'll be able to give you an idea of what sits within that project cost. Okay, but summary, operating costs are things that literally already exist in your organization that you're going to draw from, or kind of administration, those things that happen behind the project that you need to keep it running. The other 80% are project costs. The max funding you can apply for is 100K. Thank you, Tony. So if you've got an existing program that has received funding from Te Whatu Ora before, we are not providing funding just to keep programs going. That, for example, I've had some inquiries, we've had this going for 15 years, we're struggling to find funding now. Would this be something we could apply for another year's funding? Okay, we are looking for initiatives within community groups in those priority communities that are going to build an additional impact. So if you've got an existing program, that is fine, but maybe you want to grow that program into another area, for example. Okay, so you're impacting another community, or perhaps you want to reach, a different population within there. Or perhaps part of that community, you'd now like to focus in on one of those priority groups, and you've got really good evaluation data about how it's been working, and we now want to see how that works within another group, for example. Okay, so we're not just kind of going to go, we're not doing anything new. We're just rolling over. We want to see, that impact happening and new things happening. So hopefully that helps answer that, Martin. Yep, absolutely. You can have a chat with us before applying. So if I go back a slide, if I can go back a slide, let me just see that if you go to this website, all this information is on there, and there's also a contact us, which will give you an email to come through to myself and Vicky, and we can help work through anything there. Just catching up with Chase. Yep, again, Chase, so we are looking for project funding, not business as usual. Okay, so this is not a fund that is for business as usual and helping you continue. And look, I feel for you. We're Mental Health Foundation and in the exact same situation as a charitable organization. I know this is really tough for organizations at the moment, but this fund is particularly to improve the current climate that we've got in suicide prevention and postvention. So we're wanting to see that growth and new things happening, new community connections being made. Okay, so that's why the operating costs are 20%, because we're funding projects, not business as usual. So hopefully that answers that. No, it is a 1-year project. Okay. Sorry, Anastasia, I should say who I'm answering. So yeah, it's 12 months that you've got to deliver the project. Just reading for Chris here. In terms of, good question, Chris. So Chris is asking around, by the time we make the application, how developed does it have to be? Given we are developing projects, the first 3 months of your project might be getting an advisory group in place, training people. So no, you don't have to be ready to run the project by day dot. The first part of your project plan could be development. Okay. So you would also need some funding for development, because there would be costs of people doing that, for example. So you might break it into, the first 2 months we're doing the development, getting organized, getting our resources developed, doing all those things, and then we start the rollout of the project from this date. Marie, I think probably answered that for you before. No, you can't do a single application for multiple projects, but you can make multiple applications. Okay. So they definitely, you won't be able to in the application because you'll need to enter separate budgets for both of the projects. So you will need to do different applications. It's fine if it's the same population group and you're trying for kind of different projects. I understand that the information may be repetitive, just copy and paste, but we definitely need two different applications for that, please. Uh, yes, Mark, I don't know, we will announce, and I'm making this up a little bit, but we will absolutely announce the grantees, so that will be public information. Um, I'm not sure if they will appear on our website, but I think if you're on our mailing list, if you've kind of registered for anything through this, then you will get the communications. We'll be announcing the grantees on that 4th of May, and we will make that public knowledge. I'm just not sure from a communications perspective the extent of that. Sorry. Linda, if that lived experience speaker is part of a project, okay, presenting in high schools to encourage focus on wellbeing, again, we would need to see that it meets best practice suicide prevention and that the impact for those young people is safe. So often, obviously, talking to large groups of people and then talking about suicide with A, we need that message of hope coming through, but B, we need them to be connected to support services and for that project to continue post that speaker leaving that school. Okay, so that was that awareness raising thing that I was talking about. It has to follow best practice. So make sure you understand what that is, particularly for that youth focus as you make your application. Chase, I might have already answered this for you. So, yep, 20% operating costs, 80% project costs. Okay, so anything you needed to purchase that was particularly for that project, that is a project cost. The operating cost is your BAU or what you would need to, keep that program running in the background. So you need someone answering emails. You need those things that may already exist within your business. 20% can go to that. 80% is project related, and that includes the project related includes staffing costs for that project, but they wouldn't be, we've got a therapist and we just want to pay part of their salary, but they are also going to be doing this project. They would be contracted onto that project, and that is how they would be paid for that work. Okay. If you're still confused about that, drop us a message at SP Fund and I can have a chat with you and we can talk through some more examples of that. Paula, again, great question. If it's a small group of people, yeah, absolutely, community consultations. So, we've got some very small priority community groups across New Zealand. So we want to hear that lived experience. What we're saying with that is we don't want someone to design a project for a priority group without the voice of that priority group coming through that application. Okay. Ooh, we haven't had any past grants, so that would be through Te Rau Ora have the Māori Fund, and I'm sorry, I'm not sure if that's on their website, and Lavar have the Pacifica Fund. They do have some great story. They do have some of the kind of evaluation and storytelling of past projects that they have done, but I'm not sure if it's an extensive list, but definitely worth a look under Te Rau Ora and the Māori Suicide Prevention Fund and Lavar and the Pacifica Fund. Um, Go, we get in there, we get in there. Look at me go answering all the questions. Jared, youth workers to facilitate. Yep. So again, if they are part of the project cost, so you might need to deliver your project, you might need 10 youth workers to work with young people and they have a specific role within that project. Okay. Then they would be contracted onto that project as such. So that would be a project cost. Okay. If you had 20 youth workers who work for your organization and you want us to pay their salary so they can do this project, you can see kind of the slight difference. So we're not going to pay their salary for the organization, but we can pay towards the cost of them delivering on the project. I'm using lots of hands that you can't see like this across my desk. Christina, yes. So it's existing ones. If you've got so for example, in the construction sector that you've put there, you need to do your research around this though, because there are already some suicide prevention workshops, for example, in the construction sector that are already funded through Te Whatu Ora. Okay, so have a look, know what's existing within priority groups, and it would not be mental health first aid training that we were looking for specifically for suicide prevention. So again, look at best practice when we're talking suicide prevention. We're not just talking like some of our other funds are more well-being related or improving kind of general well-being across a population. This has to be suicide prevention specific. Okay. So um, have a look at that. Yes, it's open for applications, but if there is existing programs within that population, then that wouldn't be considered. Okay. I'm happy to talk that through with you further and link you up to some people as well, if that's helpful. Um, So, Catherine, good question. It's a project that was previously run, ended due to funding constraints, and we want to restart it. Okay, if it is not a current project, again, we want to see the evaluation data around when it was funded and how you are going to make this sustainable long term. Okay, so that's something that you have to consider within that project plan is, how do we do that? What have we learned from last time we do it, and how do we make sure we continue that growth? And is there kind of a new initiative within there for the priority population? Yep, Zoe, so that is correct. If it is an extension on that existing program, so for example, we've done this program, this is the outcome, this is the evaluation, it's showing really good impact, but to increase the impact, we're now going to add this component onto it. Okay, so that would absolutely meet the criteria. Oh, Emma, we might have to have a chat with this one because it's probably if you've already. So this is a project partially funded by Te Rau Ora. It would have to, we would need, so we're going to be working alongside Te Rau Ora and Lavar when we have these kind of dual applications coming through. So the second project, we just need to see that it's growth and it's, got an additional part to it. It's not just a continuation of what was happening before. So we're not extending your funding for a year, but we are growing the impact. Okay. But yeah, feel free to email us through if you want to have a chat through that with me further, because I understand that it's kind of a fine line. Akina. So I'm not sure I think you're just letting me know that, but if there's a question in there, oh, there it is. It's down there. To deliver on those outcomes. Yep, if it's a new project. So if you say, for example, you've had the 3-day national hui, the evaluation came out, this national hui was funded, and the recommendations post that were this, and this, and this is the project we've now put together to take the next step from that national hui. Awesome. Oh, I've still got lots of questions here. Consider comments between applicants. Um, Look, we want to see the connection, particularly if you're working within the same communities, Chase. So I would say it's the opposite of a conflict of interest. We wouldn't view two organisations talking together, and some of the applications that have already come through, I've seen really strong community connections between organisations. Okay. And the support from organisations for a specific group to be doing that mahi in their community, those sorts of things. So no, absolutely not a conflict of interest. And yeah, if you're both applying for similar projects, then join together and do an application because you know the likelihood is from the judging that if we've got a very similar project in a single community, we're unlikely really to fund both of those projects because we want to see that spread across the country. So please do chat and connect, and you can make a dual application for those. The one piece of advice I would give to applicants is know your suicide prevention best practice. Know the community and what works in that community, and then make sure that you show us the impact that you're hoping to have with that community. Okay, so those four bubbles that I popped up, those are really important from the Every Life Matters perspective. And that slide here, we'll go back the other way. This one. I've literally given you my scoring and weighting of the scoring. Okay. So make sure as you go through that you're really hitting those targets within there. Jared, qualifications for presenters, etc. Look, it's going to depend on the project entirely and who you're presenting to. So there's, for example, I can't really give a qualification standard, but I would want to know that they are being trained effectively by someone with the knowledge around suicide prevention and postvention. So, for example, you might have I'm just making stuff up here, but you might be training a group of youth mentors to work with other youth, or, it might be marae based or iwi based. I want to see that safety is there from both a cultural perspective, but also from a suicide prevention, post-prevention perspective. Okay, so it's less about the qualification and all more about how we're ensuring the safety of those facilitators and that the information they are delivering is best practice. Okay, so show that throughout your application as you go through. Yep. So Erin, I want you to show, so Erin's just asked around the kind of well-being, how do we link the well-being resilience to the Suicide Prevention Fund? When really get au fait with that research around how building those protective factors and increasing accesses is part of suicide prevention when we look at primary prevention. Okay, so we're going to have a lot of applications that are, you know, a primary prevention focus where we are trying to get to it before we're experiencing that population is experiencing significant mental distress. Okay, so that is suicide prevention, what you're explaining to me, but you have to show that you understand the link between the two in your application. I would say have a look at our suicide prevention resources on the website and understand the language and those things that are coming through, and do life keepers as well because that will be useful. That's all right, Chase. That's what we're here for. You can ask as many questions as you want. Also, I should say, feel free to leave if your questions have been answered. You don't have to stay. I'm not watching and marking you in accordance. So Chase, yeah. Hmm. No, that high level systematic factors is, that's a big part of that postvention stuff. And also, like we said, that's a very strong lived experience voice that comes through, that access to support is very hard because of those systematic factors. So absolutely, you could have a project that isn't necessarily working with a priority population, but is improving access um, and how that service provides for that priority population. So no, what you're saying there would absolutely meet the criteria, Chase. Anastasia, again, if it's one organization and you're spread across three different communities and that same organization is going to be doing the same project but in say three different communities across New Zealand, for example. If it's one organization then and the same project, make it one application. Okay. If you have different priority groups, for example, or different things happening in each of those communities, so they're different projects, then make separate applications. Hope that makes sense. But yeah, one organization and it's kind of more regional, kind of like you might have three offices, then one application, but three different projects, three different applications. Um, Oh, you're testing me there, pal. I don't think Virginia is online. It's been a while. Pal, can we have that conversation? Can you please email me directly? Because it's a bit of a long answer. So that's one we'll have outside of here. But yeah, definitely if you can read that Every Life Matters doc first, and if you can see the differences and similarities between the two. And if you've still got more questions, let me know and we can have a kind of further conversation around that. Marcia, yes, absolutely. Yep. So if you were looking at strengthening that cultural competency and support and offering services that were more appropriate for a population, both for prevention and postvention, yep, absolutely fits within there. Absolutely, Paula. If you go onto our website and you'll see an apply now button, then you can open it so you can see all the application questions and what's required, and you can download the PDF so that you can sit with your whānau and kind of talk through what you require within that. And look, for those of you who are coming from that lived experience, individuals or whānau applying to make a difference within your community, please don't get overwhelmed by the best practice either, but just kind of keep the language and things in your head as you're making that application and feel free to ask any questions because we want this to be open to everyone to apply, not just for those organizations that work in this space. No, Linda, we do not provide any funding for writing the application. Okay. So that would be your existing BAU. Uh, Cynthia, hopefully anything's possible, but unfortunately that's not our call. So that will be up to Te Whatu Ora whether they have further rounds. Like I said, both the Māori and Pacifica rounds have seen further funding post the first round, but there are no guarantees. So fingers crossed. uh, Thanks, Pyle. I can't check my emails at the moment while I'm on here, but if you've sent it to spfund@mentalhealth.org.nz, we will have got it. If you have any problems, feel free to also go through to the info@mentalhealth.org.nz off our website. If you submit multiple, can more than one get approved? And yep, more than one can. So they can be totally separate projects. They will be judged according to their own, the scoring matrix will be for each individual project. Would it impact the budget value? Well, the project cost is probably not going to change because obviously we've only got that 20% of operating costs in there. Even if you're delivering two projects, you've still got separate operating costs for each of those projects. So yeah, totally separate applications. We are wanting though to ensure that we are reaching across the country, across the priority population groups, and across prevention and postvention. So yeah, that will be taken into account in the judge's final decision. Which I know is hard because we could have some really awesome ones come through, for example, but we just can't provide funding for everything, and we need to get that reach across. Project that had different ways of creating impact. You could put that into one project, Jared, if it was all for the same priority population and being done by the same people. So, as your project plan, it might include Tane groups, it might include events, and then on the side of that, you've also got a social kind of media health promotion campaign going out to that population group. So that could be one project. I just want to know if the project information given to the people being supported have to explicitly state. Yes, Erin, it is the yes, to answer your question. So we've got the strategies, etc., but we want to know that the project information given to people being supported explicitly state that it is about suicide prevention. Okay. I would highly recommend that you are able to link what you are doing, your project, and then you need to link that to the suicide prevention practice. Okay, which was that first slide that I popped up. Show that link between the two. Okay, for those who are more kind of research based or that systematic one, again, you might not be working directly with the population group, but that data around that lived experience voice around how hard it is to access, or this research could be groundbreaking and change how the government sees suicide prevention for this group, that kind of thing. Okay, so there does have to be that link there. I think I've done it. I think unless there's more up here, I think I've gotten through the questions, people. Look at me go. Alrighty, guys, I know it's a bit complex, particularly when you start getting into that budget, but the main things I want you to think about are, even if you're kind of doing that early well-being, trying to prevent it getting to mental distress, you have to show that link around that priority group, the risk, and how what you are doing is having an impact in regards to suicide prevention. Okay. Community led. We want solutions that are community led, and we want to see that collaboration within communities and groups. Okay, so where you can do that, and that collaboration doesn't mean you have to be working specifically with another organization and do a dual application. But for example, it might be, as an organization, we already work really closely with this service, this service, this service. We've talked through the application. They might even provide a letter of support that goes along with it. Okay, just show us that you're not trying to do it alone, because we're wanting to grow those community connections, because we know that works when people are trying to access support and for education and awareness and all those things. Overall, though, look, I'm at the other end of the email, myself and Vicky, who you can't see today, and we will try and answer questions as rapidly as we can. Obviously, we've got quite a few coming through, so bear with us a little bit, and if it's a bit more complex, we're happy to have a video call as well. So best of luck with your applications. We're here if you've got questions. And I hope this was helpful. And I look forward to seeing all the exciting initiatives that come through. So haere everyone, have a great day, and we'll hear from you again in the future. Take care.